Hey, Dr. Jerry Williams with Urgent Care 24/7 here to talk to you about pink eye. So, if you're watching this video, you or a loved one or friend might have pink eye and you're wondering, "Uh-oh, what do I do about this? It's pretty contagious, right?" Absolutely, very contagious. But fortunately, this is a infection that is easily treatable and but important that you get seen because when it comes to your vision, it comes to your eyes, it's pretty important, right? So we see a lot of pink eye, both in adults and children. It's very, very contagious, very easily transmitted through direct contact. We're real bad about touching things and then touching our face and touching our eyes or rubbing our eyes. So that's typically how it's picked up. And there's a whole plethora of bacteria that can cause conjunctivitis, though viruses can cause conjunctivitis as well. And so if you have conjunctivitis, it's really important to get seen by your medical provider right away so they can do a culture to see what's growing in your eye and then also get you on the appropriate antibiotic drop or ointment to treat the infection. And there's also steroid-containing and anti-inflammatory drops and or ointments that can be also added to your regimen that will help soothe and cut down on inflammation. Important thing to realize, though, is that you need to see a medical provider right away to get the infection treated before it gets worse. Untreated conjunctivitis can lead to infections that can actually invade the tissues around the eye further than just a conjunctivitis, which is the infection of the conjunctiva, where you can actually end up with what's called a periorbital cellulitis, which is actually a medical emergency. So it's important to get conjunctivitis treated early and appropriately so you don't end up with complications. Also, conjunctivitis can lead to problems with the actual eye itself, the globe of the eyeball. So it's important to make sure you get treatment. Now, another thing that will happen when you go to get seen by your medical provider, they are going to do a thorough examination of your eyes and going to check your vision because there are some things that can cause or look like pink eye that are not in fact pink eye or conjunctivitis or an infection. And those things can include a corneal abrasion, which is an injury to the actual cornea, which is what you have on the outer portion of your eye over your iris. And other intraocular within the eye abnormalities can cause irritation and can also present with eye pain and irritation where the patient may think they've got conjunctivitis and it can be something more serious. So that's why if you have an eye problem and you think you might have pink eye, it's really important that you go get seen by a healthcare provider right away to make sure that it's, number one, just pink eye and that they can get you on the right medication. This is Dr. Jerry Williams with Urgent Care 24/7. Life is 24/7, and so are we.